digestive issues or I've got a little bit of pain here or there, but I really just want to come in and get feel-good treatment. And there are a lot of patients that just want feel-good treatment and want you to take a peek inside and let them know that everything is running smoothly. I've got a gentleman, a doctor that I work on, and every time when I finish, he knows exactly when I go, because he hears that cutting off. How am I doing? Is everything okay inside? He wants to know because he knows I'm in there looking. So we get to the point where we're under the kidneys. Let's straighten you up a little bit here. I'm going to pull you over. There we go. Good. We're going to get underneath the kidneys. You notice my arm is flat on the table so that her arm is just laying there. We just finished up the kidneys, the last part of the protocol, basic protocol. I am then going to balance the triple warmer. So I'm going to grab the Sanjiao just lightly, and I'm going to stretch the arm and Om Harim, Om Harim, Om Harim. I do that 3 times. Jing, Qi, Shen. I'm going to come to the other side and I'm going to do the exact same thing. This is where the triple warmers are from, Sanjiao. Om Harim, Om Harim, Om Harim. Okay? Now, triple warmers are balanced. I will go from that into the immune system. And I'll go into the thymus and I'll tap that. I'm going to count to 20. There are approximately 5 taps per second if you count 1, 2, 3, slowly, not fast. And when you get to 20, you've tapped 100 times. Now what you're doing is stimulating the production of the white blood cells. Come to the top of the iliac crest and tap. Again, counting slowly to 20. Come down to the lateral malleolus, the bone on the outside of the foot. And I'm going to again count to 20 as I tap. Now I'm not doing this very hard. It is not necessary. If you do, you'll cause your patient pain, and you don't want to do that. Now, KD1, the toe next to the great toe, and down 1 sun. A sun is that far. So you're coming down to right about there, and you're going to tap that. I support the foot while I do that. You can see in the mirror what I'm doing. And again, 100 taps. Depending on the age of the patient that I'm working on, the older patients, I'll work their yin and yang channels also. And after I finish these little kidneys here, I'll show you what I mean. I won't go through a full treatment, which would take too long. But for demonstration purposes, I'll show you what I'm talking about. You come up the yin channels to just above the knee and down the outside. Again, tapping.
Is this still part of the immune system?
No. No. I am now just balancing the yin and yang.
Okay.
So you do that for about 2 minutes. Okay? So now I've done that. I've enhanced the immune system. I'm going to bring down a ball of beautiful blue water. My tongue is on my soft palate. And I'm thinking blue, deep, deep, deep blue. Would you bring your loft over here, please? This blue. That's the blue you're thinking of. See how dark that
It's
is?
pretty. Mm-hmm.
Thank you. So I've got this ball. I'm going to insert that into the lower dantian. Now my tongue is on the back of my teeth, the upper ridge, and I'm bringing down a ball of fire, and I'm inserting that into the emperor, into the heart. Now with yang fingers and yin fingers for water, so I got fire and water, I'm going to bring them together. As they join, the fire and water create steam. Again, and again. Now I'm going to place my hands together like in prayer, and I'm going to separate those two, so they go back into their respective places. The fire in the heart, and the water in the lower dantian, in the kidney area. Now I've completed my immune system treatment. So I may then clean all the chakra gates. I'll start with the Baihoi. Screw it back into place. The third eye. Holding the Baihoi, I'm going to screw that third eye chakra back into place. Throat. Heart. Abdomen. Lower abdomen. And earth gate. Now I bring that straight out. I don't bend it up. Straight out. Now I'm running energy from the Baihoi and the Honyen. So it's traveling up and down the Taji pole, energizing. I may stop at the feet, placing my hands on kidney 1, and run blue energy up the legs and into the kidneys for additional empowerment. Kidneys are important. You want to keep them happy. I haven't taught you this one yet, but there are times when I want to enhance everything that's going on with the patient, and I do what is called the purple 9-star hand. This is going to be part of your exam, actually. We're going to cover it in more detail in the next class. But I place my hand over the yellow cord, extending into the abdomen, over the liver.
Purple 9-star what? Purple 9-star?
Yes. What you do is, I create the Big Dipper here by going to point 1, 2, 3, 4, that's the cup, and then down the handle. Cup and hand. I do that 9 times. This is a Dennyism. It is not in the book. So I do that 9 times. Then I do the Little Dipper. 1, 2, 3, 4, 5, 6, 7, 8. I'm doing the cup. And I'm creating the Little Dipper. Now the color for the Big Dipper is gold, and the color for the Little Dipper is silver. Now, 1, 2, 3, 4, 5, 6, 7, 8, 9. Now, for the 3 purities, 1, 2, 3, 1, 2, 3, 1, 2, 3. 3 purities, 3 times. Then your thumbnail goes into the middle finger. that opens the third eye and allows you to see into the patient through this hand. So I am holding pressure there. You see how white my finger is? That nail is dug in. The energy that is flowing from this hand is enormous. This is the hand mudra for the Big Dipper. This is the hand mudra for the Little Dipper. I have now invoked Dao Mu and Lin, which are the two goddesses of the Big Dipper and Little Dipper. And I am asking them to flow through this hand that golden light, molten liquid gold, and gold as a silver. So they're coiling together and coming into this hand, across my shoulders, down this arm, out my little arm, into the patient. All that energy is now flowing into the patient. And what I'm doing now is just regulating. So I've done the immune system, I've done Om Harim, I've done water above fire, or water below, fire above. I've done all of the chakra healing. This whole treatment in 20 minutes and a half an hour, including doing the basic protocol. So then I will, more than likely, not always, because it's not always necessary, but more than likely I'm going to come up to the head, I'm going to place my hands like so that these two fingers are in the foramen, right here. These two are here, and this one is here. That brings me into the sea of marrow. And there are variations as to how this is done, but this is the way I do it. I fill the brain with divine healing light and love, and the entire spinal cord. Not the column, the cord. Then I fill the skull and the spinal column with divine healing light and love. Now this opens me up to all of the bones of the body. So I then fill the arms, the humerus, radius ulna, all of the wrist bones, all of the carpals and metacarpals, which are the fingers. Then I fill the rib cage, the pelvic girdle, both femurs, the patellas, tibia fibia, the calcaneus, the heels, all of the bones of the foot, all the tarsals and metatarsals, the toes. I now have every bone in her body rejuvenated with new marrow, blessed marrow. I may bring down a column of divine light and work within it, depending on what I'm treating and what I'm doing. So I can take all of the energy of the spleen and the liver down and out, purging. And then I will bring that energy back into the liver and spleen, regulating, tonifying, enhancing how they function. Because the liver and the spleen, they work with each other. That spleen is necessary for good digestion. Transports all of the nutrients to where they need to go in your body. In Western medicine, nobody gives a damn about a spleen. But the spleen is very, very important. We had a Shih Tzu, and she had a kidney issue. She had to have a kidney taken out. It was necrotic. And just for the hell of it, they took her spleen out also. I was so upset. They don't ask. Well, we were in there. We decided that the spleen should go too. I mean, really, how dare they? So, you pay attention to the spleen, you pay attention to the liver. We've enhanced the kidneys. We have purged out liver fire, if there was any. Sometimes your patient may be getting headaches in the afternoon. That's liver heat rising. That's what will cause that. Digestive issues, spleen. So whether you know or not know that your patient's having digestive situation, it's always good to just simply go ahead and treat sometimes. I've done my scan when we were doing general protocol, so I know what's going on with the body. I will probably always finish up with the River of Divine Light. I stand at the head of the table with my hands in this position so that I am working with the whole body here. And what I'm going to do is take the Jing, Shen, Qi, Jing. And then I'm going to go Jing, Qi, Shen. So what I'm doing first is I'm having the Shen melt off the end of the table and going into the vortex. Then the Qi is going to melt off the end of the table and into the vortex. And then the Jing is going to melt off the end of the table and into the vortex. The only thing remaining will be her eternal soul, which is housed in the heart. Now I'm going to reconstruct the entire skeleton. All of the muscles, the entire circulatory system, nervous system. I'm going to rebuild all of the adipose tissue, all the fat. I'm going to rebuild all of the organs inside the body. You can do them individually, or you can just say, I am rebuilding all the yin organs and all the yang organs. Name each one of the systems that you're rebuilding: circulatory, nervous system, alimentary canal. And when you finish rebuilding the entire Jing, place the skin back around the body and shrink it back in place. Whoosh! You don't want sloppy hanging skin. So shrink wrapper. Then rejuvenate, not replace, rejuvenate the RNA and DNA. I do that with sword fingers, doing a chain. And then I rebuild a beautiful blue Qi, whoosh, and a beautiful red, golden Shen. And you've got the River of Divine Light. Then I'm going to do my Master Couple Points. Notice that when we do general protocol and we're finishing with the kidneys, we do the Master Couple Points. And I'm running a microcosmic orbit, up the back and down the front, up the back and down the front. That's the fire channel. If this woman had high blood pressure, I would run the water channel, up the front and down the back. Then I remove my hands, always releasing the ankle first. I come to the other side, grasping the wrist. You see how I'm doing that? The thumb does not wrap around. You want the low gong on the wrist point. And you go to kidney 6 here, and you're up the back and down the front, up the back and down the front. Then you're going to come back around, and you're going to continue with that microcosmic orbit. Up the back and down the front, up the back and down the front, up the back and down the front. I'm going to place my hand at the Bai Hoi and the lower Dan Chen to correct any mistakes I might have made, any errors in energy movement. This corrects everything. And then I'm going to bless the Jing, bless the Qi, and bless the Shen. I then will remove myself from the patient by cutting off. And generally at this point, I'll put my hand on the shoulder and say, we're all done. You get up when you're ready. I step out away from the patient and I purge. I bring down Divine Presence, purging my Shen, my Qi, and my Jing of any pathogenic energy, any cancerous energy, any negative energy. I added cancer to it, it's not in the book, because I was unfortunate enough to meet cancer head on. Then I fill my Shen, my Qi, and my Jing with divine healing light and love. This is my own personal ending, Te Het Yo, which is mine for, and it is so. And then I say thank you, and I bow. Thank you, and I bow. Thank you, and I bow. And that's my basic treatment that I do with almost every patient. Now, if they have additional problems, such as uterine cancer, ovarian cysts, or tumors, or whatever, I'm going to treat those individually. If we have headaches, or we have a brain tumor, I'm going to treat that. But for a general treatment, what I just finished is a good treatment. You've covered just about everything. Okay?